Welcome to the Counselor's Soapbox video channel. Today, learning about alcohol part 12, medical complications. In this video, we'll look at alcohol use disorders, the medical disease. Alcohol use disorders are the most common chronic disease in the United States. Prevalence is estimated at 9% of the U.S. population. Early in the disease of alcoholism, the symptoms are largely behavioral. Alcohol dependency, or severe alcohol use disorder, is a primary disease. Medical complications of alcoholism are secondary complications, and those with an alcohol use disorder have a worse quality of life. Some visible signs and symptoms of alcoholism. The chronic alcoholic is thin, bloated, typically middle-aged, often anxious or depressed, has a jaundiced yellow skin, and is chronically fatigued and weakened. They walk with a haltering and broad-based gait, have multiple bruises, perspire heavily. The voice is often hoarse or croaking, frequent hiccups, odd odor on the breath, and frequently they have dental problems. Gastrointestinal problems accompany alcohol use disorder. There can be irritation, bleeding, malabsorption of nutrients, a loss of appetite, diarrhea or constipation, frequent morning nausea and vomiting, damage to the esophagus, gastritis, and ulcers. Alcohol can also damage the pancreas, resulting in pancreatitis, with acute inflammation, nausea, vomiting, diarrhea, and upper abdominal pain. This can result in diabetes or pancreatic cancer. Alcohol consumption can result in several types of liver diseases. Acute fatty liver can happen even after just short-term drinking. Alcoholic hepatitis can occur. Many people are familiar with cirrhosis of the liver, which is caused by alcohol. Half of those who have alcoholic cirrhosis and continue to drink will be dead within 5 years. And alcoholic cirrhosis can cause low blood sugars and brain problems, but can also sometimes cause high blood sugar. And one other problem, alcohol may cause cancer of the liver. It may also cause kidney failure. Symptoms of these can be jaundice, weakness, itching and welts, a low-grade fever, loss of appetite, nausea and vomiting, weight loss, and darkening of the urine. Alcohol consumption can also affect the hematological system, or the blood. It damages red blood cells, can result in anemia because the body can't make red blood cells quickly enough, or the red cells that it does make are defective. Alcohol use can result in bleeding, can destroy the blood cells. Sometimes there is lead in moonshine or some other commercial products. Alcohol damages white blood cells, increases the frequency and severity of infections, affects the platelets, which are involved in an increased risk of bleeding, and alcohol affects clotting factors. So this can result in clotting everywhere or bleeding to death. Alcohol consumption, particularly excessive consumption, can damage the immune system. Two separate immune systems have been identified in the human body. Alcohol affects both. And this increases the risk that someone will contract HIV, or once the person has HIV or AIDS, alcohol consumption will make it worse. Alcohol affects the cardiovascular system. There's a thing called alcoholic heart muscle disease, beriberi heart disease, additives in beer to make it foam, or hold its foam better include cobalt, which can be damaging to the cardiovascular system. Alcohol can result in abnormal cardiac rhythms. There's a thing called holiday heart syndrome and Monday heart attacks, which frequently happen just after times when there is major alcohol consumption. Alcohol results in dilation of skin blood vessels and capillaries, can cause arterial sclerosis, hardening of the arteries, uh, results in hypertension or makes hypertension worse, and alcohol consumption can increase both the systolic and diastolic blood pressures. Alcohol affects the genitourinary system. When blood alcohol content is rising, this inhibits the antidiuretic hormone, resulting in an increase in urination. There's no inhibition of the alcoholic diuretic hormone when alcohol levels fall, which means that as blood alcohol levels are falling, people stop urinating because the alcohol has dehydrated them. Alcohol can also increase sodium retention, changing the blood chemistry. What's ahead for the Counselor Soapbox video channel? More learning about alcohol videos, more drug education videos, and some mental health and wellness videos. If you've enjoyed this video, please click the like button directly below and subscribe to receive new videos as they are completed. For more information, please visit the CounselorSoapbox.com blog, where you will find articles on mental health, substance abuse, and having a happy life. The David Joel Miller fiction and nonfiction books are available on Amazon.